Hello everyone, I am Rajiv Gupta, curator of TEDxKanke. We are organizing TEDx program at Ranchi to bring the best ideas, great people, those who are working in their stream and helping the humanity in their best possible way. Today at this session, a person who is on a mission and who loves to blow his candle on 6th of July. Why he's on mission, what he's doing, and what's the main purpose that he's trying to serve the whole humanity. His idea is right to life with dignity. How he's pursuing his dream and he's fulfilling his dream in such a best way to serve the humanity to a great extent. We have Mr. Atul Gera. He is a social scientist, volunteer, and a great human being. When he started this mission, you will hear from him and why he is doing, why he is willing to serve the whole humanity. It's a great move to get inspiration from him. So thanks Atul
Thank you,
for
Rajiv
this
ji.
accepting our invitation. So looking forward to get your insight.
Thank you so much, and thank you, TEDxKanke, for this opportunity. I think it was just a matter of a moment that we just gone into this service and this beautiful service, and it's the journey started as being a donor myself when I donated blood for the first time, and it was just an occasion that. This moment is about, I think, 22 years back when we just were introduced to the new mobile phones, and I was in a blood bank where there were a couple of more people who were looking for blood, and at that time there used to be no stocks in the blood banks, so people obviously had to rush for donors, and they got the blood tested and used to take it for their patients. So I was just able to help a couple of patients there, and at that I remember the time when even you were charged for receiving a call, and the SMS was also pretty costly. So because I was born here, and I have a big family here, and I've studied here, so I have a good big circle here. So I could actually facilitate a couple of donors for patients who were there. So, and it just started the journey as in the blood bank started, circulating my mobile number to people. And this is how, because we started getting a lot of calls, and gradually it grew up in last 2 decades. And in this journey, I think we got connected to a lot of patients who regularly required blood. That is, these are the patients, mostly children, who are suffering from a disease, a genetic disease like thalassemia. So, and in this journey, we got connected to a lot of parents who were, looking blood for all the time for their own children. And we could closely get to know the pain and, the family goes through, and what these children, look forward to that unit of blood, for then it's like a renewal for the next 15 days, and how the next 15 days would be, because their body is requiring that unit of blood to again keep going. So I think it was a very tough and a very painful experience when we got close to these children. And then one thing, till 2012, I think it was, I think we all were also not much into the best practices, and that's the fact how, in the journey you get to know what's the best practice and how the way you should, go forward about an initiative. So I was lucky to have met the finest people of India, and who were already into best practices. And I think from 2012 we started, very passionately, we really wanted that, how we could bring a change into the system by doing a lot of blood donation drives. So 15th August 2012 was the day we started blood donation drives, and slowly, the connection with the families, because how the system got easier for them, and when we understood how, the system has been so painful, and how the dignity of a human is being challenged while, the whole process is for taking blood for their patient. So while understanding the whole process, I think there we understood our role into it and how we need to go about it. So
when you have just got such kind of experiences and you keep working, connecting to the people and connecting to those people, those who actually want. And we have also seen during this crisis since last 2 years,
yes,
how the situation became so pathetic.
right.
That was a great challenge for everyone. And person like you still moving and working on the front.
I think there are two things. I think the last 2 years when we talk about COVID, I think this was an emergency time.
True.
And when it's an emergency, the same people who in normal days and behave or react or respond completely differently while in emergency. So during this COVID time, the time was it was a personal, it was a difficult time, as in for us, as in because our personal life and the family is more worried, and it is more difficult to convince the family to come out of your comfort zone and be out. But when we talk about how things are happening, a lot of time it is so easy, because in emergency and during emergency you get more hands.
Yes.
There are more people who are responsive to the situation, and on our ordinary day everybody is busy in his own life. The priority changes. So during the whole COVID times, the priority was again back to life, and the priority was different because people were off their work. People were not into their work, and everybody was distracted, and everybody was talking about COVID patients, and because somebody or the other in the family or friend circle was suffering and was needing, at that time plasma was one thing which was always on the table. A lot of people were requiring that.
During the crisis, people became more responsible.
Yes.
Responsive, and they also understood the purpose of life. Let us save so that we will be safe.
True. And but again, coming back to the normal days, unfortunately, we do not want emergencies. We all want that there should be peace in our life, and it should be an ordinary normal day like before. But I should tell you, normal days are much more challenging than emergency days. So when it's a normal day, you won't find people. Everybody is busy in their own life. But there is a big section of society who needs us, and a lot of us are not there. So for us, as in now we have taken up this on our shoulders that yes, we need to push this movement ahead. And also because I think now we relate to this, a lot of us and a lot of others also know us for this. So there is a connection, there is an unsaid, untold responsibility on us. We are just volunteers, but because that has the whole the initiative, the whole subject is also connected to our identity now. I am here today sitting with you in TEDxKanke, in such a prestigious stage, only because of this initiative we were part of, because a lot of people know us for this initiative now. So it gives us also a lot of responsibility and a lot of push and a lot of responsibility to take this movement to certain level, as in the best practice what we keep aspiring that the whole system should come to that level. So coming to the very first point which I really want to focus on is when we're saying that that life with dignity, donate blood and save life, or the whole idea about this interview is also. So when you need blood, the whole system is like people go around and people keep looking for donors, and in reality when you talk about what's the system, what government has the rules and the directions, as in policies, it's so clear that it is the responsibility of the serving or treating hospital. So it is not the responsibility of the patient's family to arrange blood. So, and in most of the cases, these families who are given the responsibility to arrange blood for their families are a lot of time not in their own city. They have come out of the city to a new town, to a bigger town for treatment. They don't know anybody there, and they might be from a very simple, humble family, and now they are asked to bring a lot of people who would donate blood. So, wherein in a place, and maybe place like Jharkhand, where there is so much a big crowd which is already anemic, there is malnutrition, there is lack of awareness, there is lack of good education. So there are already so big challenges. So I think the whole idea what has driven us is, and when we talk about dignity, that the system should work, and this is the reason why we filed a PIL, and we have been continuously voicing the idea about the mandate of the government. So what we speak, what we say, what we write, and what we fight for is again what the government has told us in 2001, that see, this is the national blood policy and this is how it will be now and forward. But it's not happening.
So you mean to say the right to life is just a fundamental right?
Absolutely.
And the government and hospitals and those major stakeholders, it's their responsibility.
Yes, yes.
That responsibility, there must be a proper education.
Exactly.
People should know what to demand, and if they are not getting,
yes,
how to voice and how to tell them, yes, this is your
yes,
duty.
and what we are saying and voicing is what government has actually put it on papers. Yeah. This is their mandate, but unfortunately the implementation part has been so bad, so poor, that people still are into those malpractices of a system which brings unsafe blood. And I am not hesitant in telling that there are so many thalassemics who have become HIV positive because of blood transfusion. And there is a huge data, not only thalassemic, but a lot of other patients who have got, there are chances of 5 transfusion transmitted infections, that are HIV, hepatitis B, hepatitis C, malaria and syphilis. So it is so important to have, continuous blood donation drive, which is the source of bringing safe blood into the system. And this responsibility of doing this is on to the service provider, the treating hospital, at least for his own patients. They need to organize this for their own in-house patients. And once we do that, there will be a huge possibility and the best chance of people getting safe blood. And not surprisingly, I can tell you this information, give you this information also, that Ranchi has become HIV capital of Jharkhand. It was not that, not the capital before. So these numbers have grown, and I'm sure the unsafe blood contribution has been a part of it. So we don't have the data, government doesn't have the data, but this is real. So government needs to think, needs to ponder that why it has happened and what contribution of unsafe blood is there, into the growth of the percentage of HIV patients in Jharkhand. So not only that, the whole pain around this is very disturbing. When people from other places come and they are not getting blood donors, and a lot of time they are subjected to malpractices, subjected to pay professional donors, and even when they are Ayushman Bharat beneficiaries, they are not having enough money in their pocket. And we have known so many people who have sold their land, who have mortgaged their property, their animals, their grains to people just to pay the hospital bills. So, and this big hefty hospital bill had a small contribution of, these people paying to professional donors even. So, I think this is what we have been fighting for. And fortunately, unfortunately, there are times when, government is pro, and there are times when government is not interested. So, yes, I think, and they just need to be made, made more sensitized about being more human. I mean, even if they are not getting credit points, I think we all need to remember every donor who is donating blood today could be a receiver tomorrow. I have donated 90 times and I meet an accident. Now I need blood. So when I need blood, whom I look up to? So I should be looking up to my system, my government, and that government needs to give that blood to me with dignity. And this is why we want that, that there should be blood sufficiency, so that everybody should get blood whenever in need through the system. He shouldn't be begging around, looking for people to give blood.
So you are saying donate blood not for others, but for yourself.
Absolutely, absolutely. You never know when you might need it. So people need to be made, aware about this, made to realize this, you are part of this society where anybody, whoever, or everybody who needs blood never knew that he might need blood. Yeah. So we could be any one of those who, who might need blood in future. So what we need to do is we need to keep our system healthy. We need to have blood sufficiency to the enough point that everybody who needs blood should get that blood easily. That blood should be affordable, and then it has to be a complete, clear access, to the patients. So I think this is what we have been fighting for. And not only that, we keep voicing, and that is the one reason we are also in action. There is a group of volunteers. We keep doing a lot of blood donation drive to the point that we try that every day there should be a blood donation drive. And also because there is a center in Sadar Hospital, Ranchi, it's a government blood bank there, and the government hospital which has 600 thalassemia children. So, and they know the pain, So we try to ensure that all these children get blood on time, and we keep thriving and connecting to people to have blood donation drives for these patients.
That's a great effort, Atul, and whatever you're doing, it's very commendable. What a big message you want to give to the world, because it's the time to act.
Absolutely, absolutely. I think there is no big way of life, or no big way of getting happiness into life by giving others. So once anybody, if you want to really start living life, start giving. It could be blood donation, there could be a part of it, but giving, somebody and living for others is the best way to live life. And you can only do that, only experience that once you start doing it. You won't find this just by saying it, but once you start living it, I think no big happiness, or there is no other way to get this extreme level of happiness into your life. And you start it makes you also, it brings a lot of humbleness in your life, and it gives you so much, brings you to the real and reality of life, which is so beautiful, I think. So I think once anybody start living for others, I think he reaches to a certain level in which he actually feels happiness inside. So I think giving is the best medicine.
That's once again a wonderful interpretation, and whatever you are doing actually. When you serve the society in such a way, it actually get connected with the God and super soul actually.
Yes.
In service to the whole humanity. Actually.
True.
So thanks, Atul, for your great initiative.
Thank you so much.
And TEDxKanke is really proud of you, just to get all your insight in whatever you're doing. Hats off to you.
Thank you so much.
So thanks for this wonderful suggestion, your interaction and your description, and telling about what you are doing. Let's hope that we will just create some footnotes and to create some footprints so that humanity will be in a better hand.
Yes. Thank you so much. Thank you, TEDxKanke.